and welcome back to the Care Plan. My name is Jacqueline Boyd. I'm the owner and founder, and I'm so glad that you've joined me today. Today we're going to be talking about hospice. Hospice is an often misunderstood service that's available to manage medical care in home for someone who is at the end of their lives. We have worked with a number of clients who have utilized hospice services and thought it might be useful to you to dispel some myths and explain what hospice is and what hospice is not. So let's dive in. What hospice is end-of-life care that's focused on comfort. It is also an alternative to seeking aggressive treatment for terminal conditions. What that means is that as someone is approaching the end of their lives, or the period that seems to be the end of their lives, and we define that as about 6 months from the end of someone's life, you start to see certain signs. It's harder and harder for the body to bounce back. The person may say that they're uncomfortable and that they just want to be left alone. They may not be responding to treatment. At that point, it really is the individual and the family's decision to think about which path are we going to take. Are we going to continue to aggressively treat this condition, or do we have another option? Hospice is essentially that other option, and oftentimes is at least worth a conversation, even if you're not sure where the person is at in the aging process. Hospice is also in-home medical support. That's the goal. There are many hospice organizations available to you, but all of them will provide these essential services. The nurse, a CNA, a certified nursing assistant, to come out a few times a week to help with sponge bathing and some personal care, a chaplain or a social worker, in addition to sometimes a music therapist or a massage therapist. All of these services come together under the umbrella hospice to provide interdisciplinary care to your loved one and to the family or support system that is helping manage their end-of-life needs. Hospice is covered by Medicare, so it's a service that is available to anyone with Medicare coverage, and all of those professionals can work with your loved one in their homes at the time when they need it most. Hospice is often misunderstood, we find. It was never designed to be called in the day or two before someone passes and transitions. The goal of hospice is to really support the whole end-of-life period, the last 6 months of life. Oftentimes families are afraid to have this conversation or are unsure where their loved one is at in the aging process. But if you're seeing a pattern of multiple hospitalizations, a lack of response to treatment, and your loved one is not improving, it may be time to think about having the conversation about hospice. Hospice is also something you can request. Your doctor, because they're on the path of treatment and making sure that they've done everything they can to improve the health of their patient, they might not immediately be thinking of hospice. But you can absolutely bring it to their attention, or you can request a hospice consult on your own if you think that it might be time. So let's talk about what hospice is not. Hospice is not a caregiving agency. This is really important because a lot of times families are under the impression that hospice will take care of it all. Medicare is only going to cover needs of a medical necessity. A caregiver to be there around the clock is not a medical necessity in the eyes of Medicare. So do not expect hospice to have a caregiver sitting there with you or with your loved one around the clock. Typically family members, friends, support team, or hired caregivers are the people who are doing that round-the-clock supportive work. Hospice is also not treatment. So if your loved one is on hospice and a condition arises that you want them to go to the hospital for, they will have to come off hospice. It's not an and, it's an or. So it's possible to be on hospice and then to come off for a situation that may arise. It's not recommended, but it is possible. But that can only happen a certain number of times. So again, these are questions you might want to ask when you have a hospice consult to really dig into what forms of treatment or medical services they'll provide. But we don't want you to be surprised. So again, don't assume that you can receive aggressive treatment and be on hospice, because the two do not work together. Hospice is also not a death sentence. And I know that's strong language, but I just want to be realistic with you about the fact that Oftentimes people are under the impression that if someone's on hospice, that means they're going to pass immediately or within the next day or two. That is not the case, and again, that's not what hospice is designed to do. Hospice is there to support the last 6 months of life. So if you think that your loved one may be approaching that time period, at least have the conversation with hospice to see what's available to you and to them to increase comfort when they need it most. Thank you so much for watching today. If you or a loved one is considering calling hospice, we strongly encourage you to do so, and our hearts are with you. We understand that that can be a difficult point in your lives and in the lives of your loved ones. So if you have any questions, you can always give us a call. Please join us next week. We'll be talking about how to have that conversation regarding hospice with your family and loved ones. So thank you. Again, I'm Jacqueline Boyd with the Care Plan. Take good care.